Is it safe to take Ozempic if you have a hiatal hernia? That's a really common question. And the short answer is it's not contraindicated, but there are some important things to be aware of. If you're managing type 2 diabetes and you also have a hiatal hernia, you might be wondering how Ozempic could affect your digestive symptoms. It's a genuinely important question because the two conditions can interact in ways that are worth understanding before you start treatment, or if you're already taking it and noticing changes. So let's start with the basics. Ozempic, the brand name for semaglutide, is a prescription medication licensed in the UK for treating type 2 diabetes. It's given as a once-weekly injection under the skin. It works by mimicking a hormone called GLP-1, which your intestines naturally release after eating. This helps your body produce more insulin when blood sugar is high, and it reduces a hormone called glucagon, which would otherwise push blood sugar up. One of the other things Ozempic does is slow down gastric emptying. That's the process of food moving from your stomach into your small intestine. This effect tends to be most noticeable early in treatment and often reduces over time. It's partly why some people feel fuller for longer, but it's also why digestive side effects like nausea, vomiting, and abdominal discomfort are common, particularly when the dose is being increased. Now, a hiatal hernia is where part of the stomach pushes up through the diaphragm, the muscle separating your chest from your abdomen. This can cause symptoms like heartburn, acid reflux, and regurgitation. Many people manage these symptoms well day to day, but because Ozempic slows gastric emptying, it can potentially make those reflux symptoms worse in some people. Food and acid sitting in the stomach for longer can increase the likelihood of heartburn and regurgitation. It's also worth knowing that Ozempic should be used with caution in people with severe gastrointestinal conditions, such as severe gastroparesis. If that applies to you, it's really important to discuss this with your clinician before starting treatment. That said, having a hiatal hernia does not mean you cannot take Ozempic. It simply means that managing your digestive symptoms carefully becomes even more important. There are several practical strategies that can help. Eating smaller, more frequent meals rather than large ones can reduce pressure on your stomach. Avoiding eating late at night gives your body more time to digest before you lie down. Elevating the head of your bed, even slightly, can help prevent acid traveling upwards while you sleep. And if you're already taking a proton pump inhibitor for your reflux, speak to your doctor about whether your current treatment is still working well for you. If you're starting Ozempic, or your dose is being adjusted, keep a close eye on how your digestive symptoms change. Some increase in nausea or discomfort can be expected during dose escalation, but it shouldn't be severe or persistent. There are certain symptoms that do require prompt medical attention. If you experience difficulty swallowing, persistent vomiting, severe abdominal pain, or any signs of gastrointestinal bleeding, such as blood in your vomit or very dark stools, contact your GP, call NHS 111, or attend A&E if symptoms are severe. These are not typical side effects and need to be properly assessed. If your reflux or digestive symptoms are noticeably worsening since starting Ozempic, don't just push through it. Speak to your GP or diabetes specialist. They may be able to adjust your dose, review your other medications, or explore whether a different approach might suit you better. So to recap, Ozempic is not contraindicated in people with a hiatal hernia, but because it slows gastric emptying, it may worsen reflux symptoms in some people. Lifestyle adjustments and optimizing your reflux treatment can make a real difference. Use caution if you have severe gastrointestinal disease, and always seek medical advice promptly if you develop severe or unusual symptoms. As always, everything in this video is for general information only and is not a substitute for medical advice. Please speak to your GP or diabetes specialist for guidance tailored to your individual situation. If you found this helpful, leave a comment below, especially if you have questions about managing diabetes medications alongside other conditions. Give this video a like if it was useful, and subscribe to the Bolt Pharmacy channel for more straightforward health information.